Good morning, everybody. I hope that you, your families, and your patients are well and not affected by this pandemic. I'm doing this video to invite you to join our new international webinar on this topic. There is a psychological property that I've observed in many cancer patients. This is resilience. Resilience is the process of adapting well in the face of adversities, trauma, tragedies, threats, or significant sources of stress such as serious health problems like breast cancer or the SARS COVID-2 pandemic. Can we learn this ability from our patients and take advantages to improve our practice in this contingency? Here are 4 possible opportunities for breast surgical oncologists. Number 1. During this outbreak, we experienced a sudden shortage of resources. Less theater time, less anesthetists, sometimes less bed available, even trivial surgical masks quickly disappeared, leaving surgeons incredulous and disoriented. Well, the first lesson will be, how can we manage to increase the efficiency of our practice and get some outcomes reducing the operating times and the complexity of our surgery? Number 2. A long waiting list is likely to be generated in the next few months. This opens unexpected room for pharmacological research that was previously neglected by surgeons. Provided that the clinical trial system will still be in place, more patients could enter randomized competitive trials, and this will be certainly a great opportunity for treatments for patients and a big boost to research, likely to increase survival of breast cancer patients in the next future. Number 3. According to the American College of Surgeons triage guidelines, in selected conditions without theater facilities, patients not candidate to neoadjuvant treatment could be observed. Now, in normal times, for some of these patients, observation would be considered unethical, whereas in the pandemic era, a new field of observation may arise to understand better the natural history of the disease. Another hypothesis, number 4, may be related to management of the waiting list. If this cannot be escaped due to shortage of resources, can we manage to use time from diagnosis to treatment better? This could let patients be more prepared to receive treatment, creating sort of a pre-rehabilitation phase rather than rehabilitation after surgery. In the era of obsessive research for quality of life, are we sure that rush from diagnosis to treatment is the right way to improve outcomes? Will the COVID-19 outbreak make patients more self-cautious, if still alive, of course? All these topics will be discussed by a team of young experts coming from the hotspots from all over the world: United States, Italy, Spain, Iran, China, and so on. So please stay tuned. Contact us at our email address and join us next Tuesday. See you soon. Bye-bye.